So we're recording again. Let's go back to the PowerPoint. Okay, the humerus. Let's see what you got to know on that. So here's the humerus. There'll be questions about these various parts. We'll emphasize the shaft and the epiphyses, the capitulum, the trochlea, the olecranon fossa. So you should know the capitulum and the trochlea and the olecranon fossa. Obviously, this is the shaft. So there'll be questions in WebAssign about the humerus. Then we have the radius and ulna. Use WebAssign to determine what bone markings that you have to know. I'll emphasize the head, the neck, the styloid process. Yeah, so focus on the head, neck, styloid process right here, and know which bone is the radius and which is the ulna. So this allows rotation of your wrist and to put your hands in various positions as these bones rotate and change their position. Okay, all you got to know about the hand, we're not going to ask you about these carpals, and you will have to know what metacarpals are and what phalanges are, and the proximal, middle, and distal phalanges, which form your fingers. Okay, so I'm not going to ask you about all these carpals. You should know that these are carpals, these are metacarpals, and these are phalanges that have a proximal, middle, and distal portion. The pelvic girdle, let's look at that. You should know about the pubis, which is the anterior bone. Okay, we got somebody coming in and admit. Okay, back to the PowerPoint. So you should recognize the pubis as the anterior bone. This is the pubic symphysis. The ischium is posterior, and the ilium is the large coxal bone made up of ilium, ischium, and pubis. We'll look at some additional information, and I'll point out what you should know. So the ilium, you should know that this is called the acetabulum. So here's your pubis, and here's your ischium, the three bones that make up the pelvis. So we should know the sacrum, the iliac crest. We don't have to know that. We should know the pubic symphysis, the obturator foramen, and the acetabulum. The acetabulum is the cavity in which the femur, the proximal epiphysis of the femur forms or articulates, forms a joint here. You can tell a difference between a male pelvis. Obviously, you can see the position of the sacrum and the coccyx, the size of the female opening here, the pelvic outlet. So just understand that there's two different arrangements for the male and the female pelvis. We should note that the female pelvis is larger and has more space for delivering the fetus during birth. Okay, the lower limb. So there'll be a great deal of emphasis on the femur. You should know the greater trochanter, the lesser trochanter, the neck, the surface of the head. I think there's questions on the linea aspera, and there'll be questions primarily focused on these structures at the superior or the proximal part of the femur. The head inserts into the acetabulum of the pelvis. There may be a few questions on selected parts of the distal femur. Lower limb, there'll be very few questions on the tibia and fibula. You should recognize those bones. There's questions, I think, on the lateral malleolus and the medial malleolus. Bones of the foot, you just have to know, just like in the hand, you have to know the tarsal bones right here, and then the metatarsals, and then the parts of the phalanges, distal, middle, and proximal. So here's metatarsals and then the phalanges. So you should recognize the tarsal bones. I'm not going to ask you. I think there is a question on the calcaneus, but know that the metatarsals are connected to the tarsals and then the phalanges. And they have three parts, proximal, distal, and two parts, sorry. Okay. You should know the calcaneus. Okay, that's all you got to know about that. And then the phalanges and the metatarsals and the various tarsal bones. There is a question on the calcaneus, not on the navicular, cuneiform, and so on. So joints, you should know the immovable joints, slightly movable, and the freely movable. Most of the joints of the body are synovial joints. We'll give example of these types, immovable joints and slightly movable. So a synarthrosis, which is a very, very little movement, sutures where teeth are inserted into the jaw. We'll talk about what these various joints are, but you should know what a suture and a gymphosis and a synchondrosis and this pubic symphysis, and let's move on and give examples of these. Oh, okay, so sorry, make sure you look up, and these may show up in a little while. So your job is to look at WebAssign and decide what structures, what type of joints you have to know. It's basically an issue getting there and learning what these terms mean. Synovial joints, very freely movable joints. You should know all these structures of the knee joint. There'll be questions on articular cartilage, joint cavity, the synovial membrane. This picture will show up in WebAssign. We're not going to do the shoulder joint, so you will have to know all of these terms, though. Here's another view of the knee joint. Know the parts. So how do joints move? So will be very few questions on this information. Just be familiar with these various terms. Okay, let's stop there, and I will send more information out, or whatever I decide to make sure you understand. But the way to know what you have to know about joints and the bony skeletons is to study WebAssign. Okay, let's go back to the Google meeting, stop recording, stop